Hey everybody, Kevin Henry, editor-in-chief for drbicuspid.com. Thanks so much for joining us for another episode where we're going to dive into a product that is making a difference in dental practices and has also earned the Catapult vote of confidence. And with that, I'm going to bring in Dr. Ankur Gupta. Dr. Gupta, it's great to see you again, my friend.
Hi, Kevin. How are you? It's
I'm
nice to be
doing
here.
Hey, I'm doing great. I always enjoy talking to you because I love to get your behind the scenes perspective on how these dental products are making such a difference for your patients. And I will tell you, this article really stood out to me. We're talking about virtual reality glasses from Paperplane Therapeutics. I love the case that you brought to life in this article and how these virtual reality glasses made such a difference for this lady.
This was probably one of my favorite and most innovative and most creative product review we've ever done at Catapult. And we do a lot of product reviews at Catapult, and a lot of the products are fantastic. This was one of the few that we immediately were like, we got to get this. We got to get this in our office. This is a no-brainer. It was such a memorable and special experience I've had with this product. And so I'm happy to talk about it.
And I'll be honest, and again, if you're watching this on Dr. Bicuspid, this is right in the article. I encourage you to read through it because I learned so much reading through it. And if you're watching this on YouTube, we've got a link to the article in the show notes, so make sure to click on that. But I'll be honest, you talked a lot at the start about pediatric patients and how virtual reality glasses really helped. And then at the end, you showed that it helps with adult patients as well. Do you find it's a balance that it can help with anxiety no matter the age of the patient?
Yeah. So actually, if you don't mind, Kevin, let me just tell you a little, just so the people listening have an idea of what we're talking about here. So the Paperplane headset it's virtual reality goggles that are specifically designed for dentists. Okay. Now, how is that? The reason they're specifically designed is because most virtual reality goggles allow you to move around, which is absolutely not okay if you are using those in a dental setting, because you want your patient to be as still as possible. So these are designed to actually close in, like there's a black closing in whenever you move even a little bit. So there's an incentive to the user to stay as still as possible in order to enjoy whatever they're doing on the virtual reality front. And the things that they can choose from is you can be wearing the glasses and there'll be all these little kind of gremlins or aliens or something like that you have to shoot at. And you are not turning your head to look at those. You're actually turning your eyes, you're moving your eyes around to aim at these different little gremlins. So my patients wearing these, that particular option is mostly boys, mostly young boys. Actually, just boys, just males in general. We're the ones who like to shoot at gremlins. So these kids are very focused on shooting gremlins, or these adult men are very focused on shooting gremlins. They're very still. They're forgetting what's occurring in their mouth. Okay. Another option is like you're on a boat and you're sailing down the Nile and you can see the pyramids and as they're coming up. A lot of female patients actually, they choose the more relaxing mode. And then there's a couple other modes that Paperplane has. There's like a problem solving mode, etc. So anyway, what we have then is a patient who has some kind of joystick, some controller in their hand. They're sitting very still, focusing on whatever is happening in their virtual reality world. And it's not as though they forgot that dental work is happening. I mean, if I do something that hurts, it's still going to hurt. But I'm astounded by how much less the patient's reaction is if I do something that hurts, if their focus is on something else. So I'll have a patient say, ow, but they're so focused on the game that they just say, ow, and they're continuing to play the game. And I just think that that's like kind of amazing. And so kind of magical. It reminds me of back when I did residency and I would have patients who were on some type of pharmaceutical, on some type of drug that were feeling stuff, but they were so whacked out on whatever drug that they still were able to stay still. This is like doing that only without any of the, the side effects or byproducts of putting drugs in people's system. And so that's basically what the product is. Now, your question, you had asked a question and I totally didn't answer it. What was your question?
No, it's all good because I love that you talked about how it was impactful for pediatric as well as adult patients.
That's what your question was.
Yeah,
You said,
yeah.
what's the balance?
Yeah.
So I would say 70% of the time that we use the Paperplane, it's on kids. And then 30%, it's on adults who probably had some type of very traumatic incident involving a dentist when they were kids themselves.
Which goes into your case. And again, I always love seeing before and afters, but I also love knowing a little bit of the story behind it. And I loved what you talked about, that this lady had a great fear of the dentist, and how that the Paperplane Therapeutics VR glasses really took that away in a lot of
It,
ways.
it made it made every difference. It made every difference. Do you mind if I talk about this patient?
No, I would love that.
Okay. So she came into our office. She was crying like in the waiting room. She was crying when we sat her. The reason that she came to us is because of something. I don't know, a Google review saying that we were gentle or something like that. I don't know. And I sat down with her, and she had a bunch of teeth that just needed to be pulled. I mean, these were unrestorable. They were ground down to the gum line. And I just asked her, I said, why, what happened? Like, this is a long process of these teeth breaking down. And she said, I just refuse to go to the dentist. I'm terrified of going to the dentist. What we ended up finding out was her father was in the military. It's something happened in which he did die in the dental chair. So something happened. We don't know what the specifics are, neither does she. She just knows that her father was in a military clinic and he died. And it was while having a dental procedure done. I don't know anything more than that. But what it did is it probably created this story in her mind that she's going to die if she goes to a dentist. And so she just allowed her teeth to become wiped out. Well, we talked, and both her and I agreed she needed all of her teeth removed, have a couple of dental implants placed, and have an implant retained overdenture. And I told her, I said, I don't administer drugs. I have a personal story that in which I just refuse to do that. And so I'm not going to do that. I'm not going to put you to sleep. I said, but I can send you to an oral surgeon. And she said, no, it took me forever to come in here. I want you to do all the work. And I thought to myself, man, this is going to be awful. These teeth look like they're going to be really hard to extract. And I'm going to be doing it on a patient who is not psychologically ready for it. I said, the only thing I can offer you is that I'll be nice and gentle, and I can give you this virtual reality headset. And so we did it. And the headset was like a magic wand. I'll tell you, when it was on, I was able to do anything. Surgically reflect a flap, surgically remove bone, put her in a headlock, get a tooth out. This was a violent surgery. But what I thought was interesting is, I needed to reposition her at times. Like, as I transitioned from the lower teeth to the upper teeth, I repositioned her. And when I repositioned her, the glasses kind of came off. And like the moment that they came off, she started freaking out. She was
Wow.
like, and so it was almost like a magic wand. Like, all I had to do was get those glasses situated again. And she was like, all right, good, I'm good. And we went right back to just jacking her mouth up and doing an incredibly invasive, violent procedure with her completely under control, because she was in that other world. She was in that virtual reality world. And today she has implant retained upper and lower dentures, and she's thrilled. And she can eat whatever she wants. She smiles all the time. And she keeps on saying, you changed my life. You changed my life. You changed my life. I don't think I changed her life. I think the virtual reality glasses changed her life.
That's a big saying right there. And again, reading the article on Dr. Bicuspid, you can see that smile. And that always gets me whenever we see the impact that dentistry has on people's, particularly those who are fearful and have been putting things off because of what might happen. And so to have something like this in your practice to help get that person past the what if, I think that just sounds amazing.
Yeah, it was amazing. I got another story if I have time.
You
Do you
do,
have a moment?
absolutely. Hey, I'm hanging with you.
So,
You go.
So my daughter, she's 17, and she's always been just so annoying about shots, like so annoying, like vaccinations and, drawing blood. I mean, she cries beforehand, and we're like, damn, you're old. Like, quit being so annoying about this. But she is, whatever. She just cries before she gets a shot. That's how she is. And her wisdom teeth were bothering her. She said, Dad, can I come into the office and have you pull my wisdom teeth? And it was a Sunday. And I was like, dude, I don't have an assistant, and you're going to cry and be annoying. And I was like, I just don't want to do it. And she's like, yeah, but they're really bothering me. Like, they're like, I keep on biting my cheek, and and I'm getting like food cutting. She was like, can you just do it, please? I'll try to be good. So we drive over to the office, just me and her, and I put her in the virtual reality glasses. And it was such a pleasant procedure. It was so pleasant. I mean, it was like I put her in the virtual reality. I got her numb. She didn't cry. I mean, she didn't know I was getting her numb because she was so focused. And later I was like, did it hurt? She was like, yeah, it hurt a little bit. And I'm like, why didn't you cry? Like you always cry, you know? And she's like, yeah, but you know, I was shooting gremlins or whatever she was doing. And I ended up, I mean, wisdom teeth are hard. They're hard to pull. So, I had to put her in a headlock. I had to, manually, I had to put a lot of pressure in her jaw to pull those teeth. And it wasn't unpleasant. It was just nice. And it was kind of special. Like afterwards, I wiped all the blood off of her teeth and, she's got them. And it's kind of like she was celebrating that it was so nice. And I'm like, this wouldn't have been nice. If I didn't have this special magic thing, this would have sucked. I would have been pissy all the way home because I would have thought she was such a baby. It ended up being kind of a special moment, a father-daughter bonding moment. And it was because of the glasses. That was it, So that was pretty amazing for me.
Things we do for our daughters. Oh my goodness. No, that it's fantastic. So it sounds like, and again, reading the article, there's so many different ways that this anxiety can be lessened through these virtual reality glasses. So
Yeah.
I love that you gave us the behind the scenes look. And I love the fact that again, you're implementing this in your practice and you're seeing the difference from it
It's
as well.
amazing. Yeah. It's amazing. It makes dentistry better. It's just you do a better job when the kid isn't squirming. You're not stressed out. You take your time, you do a nice job. The kid is just a block and you get to really do your best possible dentistry when you're not worried about all that psychological coaching. And so I love it.
Well, here's to getting rid of all of those gremlins that are coming in that VR glasses. Dr. Gupta, as always, man, I appreciate the time and I appreciate the insight.
Absolutely. Yeah. Thanks for having me.
Absolutely. Thanks to all of you who've listened to this episode of the DrBicuspid.com podcast. Love going behind the scenes to see what products are making a difference. And absolutely, we enjoy our relationship with Catapult. Make sure that you're checking out all the products here on Dr. Bicuspid that have earned the vote of confidence. A lot of them will be linked in Dr. Gupta's article. Until next time, it's Kevin Henry, Editor-in-Chief, signing off. And as always, wishing you nothing but success ahead.